Well, welcome everybody tonight. My name is Michael Joyne. I'm the director of the Congenital Heart Center Transition Program, and I have the pleasure of introducing our speaker tonight, Dr. Kelly Ray. Dr. Ray is a postdoctoral psychology fellow at the University of Michigan Congenital Heart Center and Transplant Center. Kelly's research and clinical interests include how mental health and well-being evolve over time among children and teenagers with congenital heart disease, end-stage organ failure, and solid organ transplant recipients. Kelly has particular interest in unique periods of vulnerability, including during the transition from pediatric to adult healthcare, a focus which is a core feature of her clinical, research, and program development efforts on fellowship and the topic of her presentation this evening. So without any further ado, Dr. Ray.
Hi, everyone. Thanks so much for having me. It's wonderful to be here tonight. And thanks to the Heart Center Transition Program as well for inviting me to speak tonight. So an overview of our topics for tonight. We'll start with just a quick refresh on what Dr. Joyne talked about last webinar on what transition and transfer are. And then we'll spend some time talking about the facts and figures related to mental health in teens and young adults, both those with and without congenital heart disease, and ways to support well-being, signs that extra support might be needed, and then how to find those additional supports. So we're all on the same page. And again, just to review what was covered during our last webinar, we can think about transition as this kind of pink box here. So starting on the pediatric side of care and continuing into adult care, even after this transfer event, which is shown here as this blue dashed line when these young adults officially change from pediatric providers to their adult providers. So before you're officially flying on your own, being fully independent in your healthcare, we're going to support you throughout as you adjust to adult care and adulthood. In addition to changing over healthcare, there are also many evolutions, if we use a butterfly metaphor here, and changes that come with being a teenager and a young adult. And so one of these things that we consider, and is really important during this time, is mental health and well-being. So why does mental health matter during transition, particularly for those with congenital heart disease? So we know since the COVID-19 pandemic, there has been an overall worsening of mental health symptoms across all teenagers, regardless of medical conditions. We know there's been a doubling of teen anxiety and depression since 2020. And this national data shows that 17% of adolescents, so those ages like 12 to 17, experience a clinical major depressive episode in 2020. And 12% of all adolescents, not just those that experienced a depression, but 12% of all adolescents in 2020 experienced serious thoughts of suicide. These are very striking numbers and point to the mental health crisis that faces all youth, not just teens and young adults who have congenital heart disease. Specific to congenital heart disease, teens who have congenital heart disease have a 3 times higher rate of anxiety and depression compared to healthy teenagers, their healthy peers. So thinking back to that last slide that we just looked at, given that we have seen such an increase across all teenagers in the United States, we can imagine that those numbers have also increased a lot for teens with congenital heart disease as well. And how this looks moving into transition to adulthood and transition to adult care. About 1 in 5 of those young adults during that transition time experience and meet criteria for a mental health diagnosis during that transition time. This number grows then even when we look at all adults with congenital heart disease, where about 1 in 3 adults with congenital heart disease meet criteria for a mood or anxiety diagnosis. One thing I'll point out here is that a lot of the data that we have gotten these numbers from were collected before the COVID-19 pandemic. So it's unfortunately likely that even these numbers here are underestimating the current picture of mental health in congenital heart disease. Now, why are there these increased rates of mental health in congenital heart disease? It is likely that this is related to multiple different things and could look very different across individual experiences. I'll talk a little bit about some of the things that these could be for, but it's also very possible it's something else. One possible factor in this is the experience of stressful life events, like being in the hospital, having medical emergencies, or other life stressful things that are unrelated to the heart. Another possible factor is the time spent in the hospital, actually undergoing procedures or surgeries, time away from being at home, being around family, friends, school, etc. There's also the potential for underlying genetic syndromes or risks for mental health concerns that can play a role in this as well. Among those with congenital heart disease, there's also increased risk for neurodevelopmental concerns in childhood, which could impact growth, development, learning, forming and keeping peer relationships and friendships, etc. Prematurity may also similarly play a role in these factors, as well as feeling different from their peers for any of the other things that I talked about or other reasons that aren't even on this list. And like I said, it's very possible that there is something completely different that plays a role in this that we are not fully aware of or is not listed here. But the big takeaway is that there are likely multiple reasons, and it's very likely not one singular thing that leads to this increased risk, and nor is it the same for all people. But there's some reasons why this might be the case. Knowing all of this, and for all of those reasons that I just talked about and more, mental health is a particularly important thing for those managing a heart condition. We know that the link between mental health and health behaviors, including those things that are so critical during this transition to adult care time, like self-management behaviors that are increasing during this transition period. This has been well supported by the American Heart Association. This big scientific statement came out in support of supporting well-being and psychological health as a part of heart care. We know that the mind, the heart, the body, they're all connected. We can't separate one from the other. So how might mental health play a role in transition? We know that psychological well-being plays an essential role in this, like participating in your healthcare, taking medications, going to doctor's appointments, etc., which is why we're talking about transition during a webinar, adding in this mental health component. So diving a little bit deeper, I'd like to use an example of medication adherence to look at this. We know that among heart patients who have to take medications, adherence difficulties, which can happen more often during this transition to adult care time, they've been associated with greater mental health distress. So this could include lots of different things: depression, low self-esteem, anxiety, general emotional behavioral problems, post-traumatic stress symptoms. Can look different for different people. And those things are associated with one another: adherence and mental health concerns. What is a little less clear is kind of that what came first, the chicken or the egg in this link. It's possible that initial symptoms of anxiety or depression, for example, may make medication adherence more difficult. For example, having more difficulty organizing your medications or having low motivation, possibly leading to intentional non-adherence. It's also possible, though, that medication non-adherence might start, and then this can lead to increases in physical symptoms and then lead to emotional distress, which can negatively impact quality of life, mental health, a whole host of things. So it's not necessarily one of these links versus the other. It's likely both of these things play a role and can look different in different people. But what we can take away from this is that during transition, we want to set teens and young adults up for success by practicing, and modeling these healthcare behaviors in this supportive environment and making those gains in independence while also supporting their mental health that can play a role in the ability to do so with this. And that includes mental health care, both kind of generally and more formal supports, which I'll talk about both throughout the last bit of this webinar. So knowing that this matters, why it matters, that it's more important now than ever, how do you support well-being, whether that's for your child, yourself, your patients? Some general tips. So those things that all of our doctors tell us all to do, like taking care of yourself through regular exercise, healthy diet, getting good sleep. They're not lying. It helps with our physical health, and it really helps with our mental health as well. So having this good foundation of behaviors is critical. So that is my first big general tip for anyone looking to support their mental health or just general well-being. Those foundations are critical. We also know that being very intentional about doing enjoyable hobbies or activities that you like to do or that bring you joy, having these little pockets in your day or your week that you look forward to doing something that you like to do. That's also very important. It's especially important to find or make the time to do those things when we're feeling stressed or down at various times in our life, when that might pick up a little bit more. And those enjoyable things or those hobbies might be more likely to fall off instead of having those stressors. Another general tip is practicing daily gratitude. Some sort of way to find something each day that you are grateful for or thankful for can help to bring some positivity and gratitude when things might otherwise seem low. They make lots of different journals or apps for your phone these days that can help with this. Doesn't have to be written down. A lot of the teens and young adults that I work with, there are like 1 second clip of the day videos that you can do on an app, a picture a day. You can really get creative, but finding some way to find something in each day to be grateful for or that was a positive for you. Lastly, engaging with social support. That can include family, friends, coworkers, other students that you're in class with, but having people that you can hang out with or talk to on good days or not so good days is really critical for all of us. With all of this in mind, I know everyone on this call is likely a teenager or young adult or has been a teenager or young adult in the past, or maybe raising teenagers and young adults right now. And we know that that time of development in general is hard. And it can be hard for lots of different reasons. But how do we know when it's time to seek help? When is this, it's hard, but it's a little bit harder than what we can manage on our own. So there's a variety of different signs that you might need additional support. Some of them are listed here. Some of them might not be listed here. So there's a little bit of like trusting your judgment and your call on that. But mental health symptoms that you might see both in yourself or in your child are of course going to be unique to them or to you. So you might have a sense of kind of what your normal is like, and when that starts to shift or get away a little bit from what that normal is one kind of general sign to think about. In addition to kind of some of the more obvious things, the ones that are not listed here, like mood swings, being more irritable than usual, increased anger, lots of tearfulness. You might see some of these things in addition to those. So loss of interest in previously enjoyable activities, big changes in sleep, weight, or eating that are not kind of obviously attributed to something else. Stopping taking necessary medications is a big one, especially during this transition time. If there are big changes or swings in academic performance, difficulty controlling worries, that can be about lots of different things, your health, heart, or other areas of worry. And then signs of self-harm, suicidal thoughts, or statements. Certainly in the case of that last one, those suicidal thoughts or self-harm, when there are any safety concerns, getting connected with a mental health provider, calling 911, utilizing 988, which is the National Suicide Hotline number that can be called or texted or chatted as well. That would be definitely warranted in a case where there are safety concerns. And one thing to keep in mind is that having just one symptom on this list doesn't necessarily mean that you or your teen or your patient is experiencing a full-blown crisis. These are kind of things to be mindful of and aware of, and kind of open the lines of communication around that. So what do we do to get mental health support if you decided that additional support is something that you or your teen or your patient is interested in? Especially if this is a first jump into the mental health space, there might be many questions that you ask yourself when you're starting to try to find supports. So some of these may include what am I even looking for? There's lots of things out there. How do I find someone? Who am I even looking for? And then what would I even be doing in therapy if that is the route that you choose to go down? So starting with what to look for in finding mental health treatment, you may consider whether you want to try therapy where you are meeting with someone regularly to work on developing coping skills or managing stressors, or in addition, or you might be wanting to start a medication that could help with mood or worries or stress, etc. You can certainly try out both things. One does not make it so that you can't try the other at the same time or at a different time. But that is a first question that you could ask yourself, is kind of which of these routes you're interested in going down. Other considerations include whether you would want to meet with someone in person or online via telehealth. Some people are a little zoomed out from all the online world these days and prefer to meet in person. However, if you live far away from accessing therapists or supports, or you prefer to be in the comfort of your own home while you're engaging in therapy, it may be easier and preferred to meet online. Some providers may offer both also, so it's important to talk about what your options could be. And then something else to consider when you're thinking about what to even look for in mental health treatment is whether the person that you are seeing would be covered by your insurance, or whether there would be a significant out-of-pocket cost for whatever service you're receiving. Even if covered by your insurance, knowing what and if there's a copay would also be important to know. And I'll talk a little bit more in a few minutes about how to go about finding somebody that would be in your insurance coverage. So now, who to look for in mental health treatment? There are lots of different mental health providers. This is not a comprehensive list as well of what is listed here. And people may do very similar things, but they may be referred to as different titles, and that's for lots of different reasons. It might be to differences in training that they had in supporting mental health, different degrees that they may have gotten to get them to the place that they have now. And if there are other responsibilities that they have in their job, that those can all contribute to having slightly different names for similar levels of support. So some examples you might see is psychologist, a social worker, counselor, psychiatrist. A therapist is also a very general term that you might hear people referred to. So there's lots of different ways. They're all like slightly different, and so asking good questions and making sure you're getting connected with the sources of support that you're wanting. Importantly, the last one listed there, psychiatrist, that is who would most likely be prescribing medications to support mood, anxiety, stress, as they have a medical degree, similar to your cardiologist or your primary care provider. They went to medical school. Sometimes as well, primary care providers are also able to prescribe medications to help with mood or anxiety, but it's important to talk with them, see if that's something that they're able to do if you're interested in that. So when you are looking for mental health treatment, it's also very important to ask lots of questions specific to your needs. I always like to tell people this when they're looking for other people, if they're not being seen by me, but it is totally fair to ask them lots of questions and make sure that it's a good fit. And I'll talk about fit in a second as well, but totally good questions to ask is, whether they worked with people with a heart condition previously, or worked with people who have other medical conditions, and what that process looked like. Depending on your specific needs and interests in what you're coming to mental health treatment for, you can also definitely should ask them if they have treated other people with similar concerns, and how they went about treating those things, if they used different strategies, and what those looked like, and if those were successful. So it's okay to ask questions. It can feel a little intimidating, like they're the ones that are supposed to be asking questions of you, but you want to know that it is exactly what you're looking for, as close to what you're looking for as you can get. The last piece of this, and I've alluded to it throughout, I cannot stress this enough, is the importance of a good fit with the person that you'll be working with. I say this every time that I'm working with someone and they're looking for other folks to work with. It is so critical that you feel comfortable working with the person that you select on what can be at times kind of challenging topics or stressful times. And it's okay if the first person that you find is not a good fit for whatever reason. And, given how long wait lists can be these days for mental health treatment, it's also okay to get on multiple wait lists for multiple different people at once, and see kind of who pops up first, and then be able to kind of see how it feels with several different people. So ways to go about finding supports for mental health. This includes lots of different ways. So one of these can be like embedded mental health providers within your care setting. So as Dr. Joint mentioned, I'm embedded with the ACHD clinic with a handful of other clinics. I'll talk about those services as well in a few minutes. So there are services available through the Heart Center embedded there that folks through the Heart Center have access to. And I'll talk about those more in a moment. You can also talk with your primary care provider. They might be able to provide you referrals in the area that they have sent other patients to, especially if your primary care provider is more local to you. They might have a pulse on who would be available in your area. Or, as I mentioned, they may be able to prescribe you medications to support mental health, depending on your interest and their comfort in doing so based on other needs. Another option is calling your insurance or checking if they have an online directory that you can search to see who is in network. As I mentioned, that's critical to make sure there are no unexpected large out-of-pocket costs. This could also help narrow down the field of who to start calling or getting on wait lists for. Lastly, I include psychologytoday.com. That is a website that allows you to put in various different references or pieces of information about what you're looking for, like insurance, what you are hoping to work on in therapy or presenting concern, any preferences you have related to a provider, like distance from you, whether they do virtual versus in person, if you have preference of your therapist gender, if you have language preferences, things like that. And that will help, again, kind of narrow down that list, generate a list for you that will get you started on how to start calling people and who to start having those conversations with. So once you are in mental health treatment, what might this look like, or what might you be doing? So every provider is a little different. So I have a caveat to before all of that, but in general, you would expect to have an initial assessment or evaluation with them where you meet with them to discuss what has been going on recently. They'll likely want to get a very comprehensive background and history of you, both your mental health history, but then other relevant things, your medical history potentially, and other areas of your background. They'll also want to talk about your current concerns that might be impacting your life and how those things might be impacting your life. And all of this information might be used to provide a mental health diagnosis if that is warranted after this initial assessment or evaluation. From there, you will usually work with your provider to identify your individualized, personalized goals for treatment. So what things are you hoping to improve on, or what things are you hoping to get better as a result of your work in mental health treatment? And then once those goals are established, and knowing that goals can change over time also, this begins the work of learning skills, learning strategies, putting in the work both during sessions and practicing those things at home to start moving towards achieving those goals that you have identified. So not only is it a lot of work to even get into mental health treatment, but the work certainly does not stop there. That's where when you are in treatment, that's where the bulk of that work really comes into play. So looking at supports here at Michigan, we have a very robust psychosocial team here to support well-being for patients through the Congenital Heart Center. So this includes 5 social workers, 4 faculty psychologists, 1 psychology fellow, that's me, 2 education specialists, 4 child life specialists. We have a parent peer mentor lead, and then we also have a young adult peer mentor as well. So with all of these supports, as I mentioned, we're integrated within the ACHD clinic, pediatric single ventricle, and pediatric heart transplant clinics. So with this integration in the ACHD space as well, we've been working to bridge this follow-up for mental health care from pediatric to adult care. I see patients for therapy up to age 30, even after they have transferred care to the adult side. So we're able to bridge that care. We are also expanding our psychosocial interventions and programs offered to patients in the Heart Center, which I will talk about more in just a moment. Looking a little bit closer at these different roles and how they can support patients and families during transition. So our social work team does an amazing job supporting patients and families across a variety of different domains. So this can be supporting coping, connecting to local, state, national resources, coordinating travel and lodging for appointments and visits to the hospital, helping with insurance, which is especially critical in this transition age when young adults are not able to be on their parents' insurance after age 26. So getting those things thought about early and often, and getting those things set up, and assisting in establishing guardianship prior to age 18 in necessary situations where once someone turns 18, they would not necessarily be thought to be capable of independently managing things on their own. The education specialists work alongside the medical teams as well to bridge between the medical and school community, which can include navigating school challenges, return to school at any point throughout development, but then kind of specific to this transition age and transition time, both obtaining these IEP and 504 plan support systems, and also making sure that those plans are in place that include these post-secondary goals, that what happens after graduation from high school or your diploma is obtained, and if there are any transition services that might be needed for vocational training, additional education, if there are independent living needs, etc., as well as preparation for those who might be moving on to college and university, and making sure that necessary services or accommodations are in place at that setting as well. And then finally, psychology services. This is obviously what I'm most familiar with. These are the services that I provide. So these include assessment and therapy for teens and young adults. As I mentioned, this is up to age 30 to address a number of different things and a wide range of topics. So this can be coping, anxiety, mood, adherence concerns, navigating, identifying life goals and values in this new time of young adulthood, and reducing substance use for any teens or young adults who might be using substances and are either recommended to by their medical teams or desire for themselves to reduce their use and find it more challenging. For all of our psychology services, many can be conducted virtually or in person, which allows for a broader reach across the state of Michigan as well. So as you may have seen previously, either both on the last webinar or seen flyers around clinic, one of the expanded psychosocial supports that we are offering is specific to young adults with ACHD. This spring and summer, we'll be having the We Beat Wellness Education Group. So this is a 4-week virtual group wellness series that focuses on wellness education and learning different sets of skills to support well-being. Some of the strategies and things that I've talked about today, focusing on learning specific skills and doing that in a structured way with other young adults with congenital heart disease as well. So this program was initially created and validated for teens who have Fontan-palliated single ventricle disease. And it has been shown to significantly improve mood and increase resilience in this group. And so because that was so successful, we got really great positive feedback, and it was improving things that we were hoping that it improved. We are now expanding this offering for young adults ages 18 to 30, and we'll be kicking these groups off in the summer. So if you are interested, the email is listed there, and I believe this will be sent as well in the post-webinar follow-up as a reminder. So please reach out if you have questions or are interested in registering for those things. So I will leave it there. Thanks again for having me, and I welcome any questions or thoughts.
For our attendees, if you do have any questions, there is a Q&A button at the bottom for you to put your questions in. So there are a few questions. The first one is, where can I get more resources or connections to specific ACHD supports and wellness?
Yeah, absolutely. This is perfect. I wasn't sure about timing. Sometimes I talk fast, sometimes I talk slow. So I included a slide of other national level resources that I saved it for the end. Let me swap through to that. So yes, there are definitely other resources beyond just what I've talked about today or what is available through Michigan. So some of these are different social media groups. So Young Mended Hearts support groups, they have an Instagram. There's also Conquering CHD as a Facebook group. Fontan Outcomes Network, they host single ventricle specific chats. They have an Instagram as well. So those are available. There's different social media platforms that people could connect with. The caveat that I give anytime I'm talking about these with people is that there can be very well-intentioned and uninformative social media pages and websites out there, but with any platform, certainly some people's experience may be more or less relevant to you or more or less helpful to you. So being mindful of how you feel when you're consuming any of those things, and always consult with your own cardiologist team regarding your individual care for sure. Another resource that is really, really good if you like this kind of webinar style series, learning about something, being able to especially go back and listen to recordings, the Adult Congenital Heart Association, ACHA, they do a Wellness Wednesday webinar series. So that includes presentations around a variety of different topics, and they have panels and Q&As with peer mentors about like once a month, and they cover lots of different topics, education and kind of quality of life issues. So some of the more recent ones that I've seen on like executive function skills, how to like improve those things that helps with school, work, organization of life in general. There's one I think coming up, or it might have already happened, on navigating relationships and dating with ACHD. So they cover lots of different things, but they're all recorded, so you could go back and watch any of those as well. So And then in addition to these national level supports too, certainly getting in touch with the young adult peer mentor here. The We Beat Young Adult group is another way to get connection and resources. So there's lots of different things that might just be finding what you are most interested in.
Just for a clarification for the We Beat, it's just for patients, not necessarily patients and their support persons or significant others.
Correct. Yes. That's one thing that, we've had a lot of interest in We Beat more broadly, and we are, at some point down the line going to explore like a We Beat caregiver or like a We Beat parent opportunity. But for now, we really want to kind of like protect and hold the space for the patients specifically during those groups. But yeah, it's a great question. It's a fair question for sure.
Next question is, my teenager is not interested in mental health support, but I think they would benefit a lot. What tips do you have for helping convince teenagers to see the benefits of mental health treatment?
Yeah, I get asked this a lot, and I see this clinically a lot. And again, unfortunately, anyone who has raised or been around teenagers, or think back to when you were a teenager, it can be very hard or almost impossible to force or convince them of something that they do not want to do or do not like. And that's with anything. When we think about something so important, as we've talked about today, and sensitive as mental health treatment, if we force them to attend therapy or make them get a treatment that they do not want, this can actually really, really backfire and have kind of the opposite effect that we might want. And it sounds like you want, for your teen, you want to get them help. It can actually, if we force them, it can push them away from using the skills or services that they're either being forced to engage with, or it might make them way less likely to want to engage in mental health services in the future if they do become interested in seeking services at some point. So, what we want for them is to have a positive first experience with mental health treatment. And if we force them, this could kind of automatically create that kind of negative experience, which we definitely don't want. Nobody wants that. I will say what you can do, is make sure that they know that you are open to them seeking treatment in the future. If that's something that they want to do, that you are open and supportive of that. You can also be aware of those signs that additional support may be needed, like I talked about, but discussing those things in a very collaborative way, not judgmental. And the things that you're noticing, and having a conversation about that, while also being a supportive figure about wellness overall, like those general tips that I mentioned of, exercise and general well-being, sleep, all of the things. So it is not necessarily forcing them into treatment, but kind of a general atmosphere of openness to that.
Another question about We Beat is that, do you have to have a U of M cardiologist to be in the program?
You do not.
Perfect.
Yes.
Next question, transitioning and then also transferring your care to can be hard on parents overall, going from pediatrics to adult. Do you have any recommendations or resources for caregivers?
Yeah, absolutely. No, it's such an important point. So many of the things that I mentioned very much apply to parents and caregivers as well, including the ways to kind of take care of yourself and your well-being, as well as the strategies of when and how to find additional supports, with the exception maybe of those embedded mental health providers and in specialty care that your child might have access to. But as Dr. Joint mentioned in the last webinar, this transition process very much involves caregivers and the adjustment that caregivers have to make in their involvement in their kids' care. So that can certainly be a stressful period for you as well. And so there are a few, knowing this, there are a few kind of national parenting supports that do exist that are not necessarily specific to congenital heart disease or her conditions, but that kind of exists to acknowledge and support the very specific needs of caregivers of kids and teens who have various medical conditions. And I'd be happy to pass those along so those can be sent out to attendees as well. There's the Courageous Parents Network that have different resources available online to support both during transition, but also generally parenting a child who has a medical condition. There's also the Pediatric Psychology Caregiver Wellbeing Group that is a special interest group of the psychology community that really focuses on supporting caregiver well-being as well. And as I mentioned, a future goal would be, a WEB that would be supportive for caregivers and parents, but I don't want to put the cart before the horse on that. We're starting lots of different things, but we are definitely aware of the role that caregivers play and wanting to make sure that you all have supports as well.
The next question, what type of research is Michigan or other centers doing to deal with the high number of congenital heart patients dealing with mental health issues?
Yes. There's lots of things. First of all, having these webinars is great. Knowing that those things are important to you all, important to your providers. I think that sets a foundation of this is a culture that is very important. So there are various different programs. So we have, like I said, all of the psychosocial supports available through the Heart Center. There's lots of different research things happening with the different groups there. As I said, the different WEB group programs focusing on prevention, treating growing mental health needs. Are those things working? Are they not? What other things, would be helpful? I think that's there's lots more research to come too from the Heart Center. So certainly stay tuned for opportunities to participate in that, share your experiences, get paid for those things, because ultimately we want to know what things are most helpful for you all. And then also are the things that we currently doing helping and what else might be offered. Regarding other centers, it's actually, unfortunately, there are actually not many programs out there that are specific to supporting mental health needs of congenital heart patients in these teen years. There's actually a recent review of all of the research and all of the data out there that exists on mental health interventions for teens, specifically with congenital heart disease. And in all of the time that research has been being done, only 4 interventions have ever been developed and exist to support this time. So it's an area of real growth and opportunity for us here at Michigan also. And so I think expect lots more to come from this too, as we evaluate the things that we're doing, what things of those things are working, and then what things we can continue to do better.
The last question that we have, unless any more questions pop up while we're talking about it, I think you've kind of probably answered it with this previous question, but are there any programs to treat children with heart disease before mental health issues arise in adolescence and early adulthood?
Yeah, so certainly, I'm a broken record here. So WEB is focused on prevention, right? Like ideally, we like to get at things before they become like a major concern or before they rise to the level of a mental health diagnosis. So certainly that program, but also those kind of general wellness tips that I talked about. It's not a formal program necessarily, but certainly thinking about those ways to have these foundational areas of wellness and awareness of those things would be what we would call kind of the treatment for managing those things before they arise in adolescence and early adulthood, and just having that be an open space to talk about wellness, both with your parents, within your family system, with your providers, and having that kind of culture of honesty and openness and talking about those things and having those foundational skills in place before that critical period of adolescence and early adulthood. Certainly.